So my co-author, so because I couldn't be there, so my co-author, Professor Hans Veders, so he helped us to present the study. So our study is a review article. So we want to really make a statement from our translational working group from the SIOG. And we want to show the importance and significance of the advantage concerning about liquid biopsy applications for the old adults with cancer. In this review article, actually, we try to assess the effectiveness and also concerning about the update of the liquid biopsy, because it's such a very updated non-invasive method, which was able to analyze, for example, circulating tumor DNA, circulation tumor cells, extracellular vesicles, or microRNAs, for example, from the blood or non-blood fluids from the patient, which would be helpful for early detection, for example, and treatment monitoring, and also able to assess the treatment response, particularly for our, the geriatric patient with cancer. So we hope that this review can really give update information concerning about liquid biopsy application in this cohort, and also to call more attention concerning about the focus on the translation research in this part. So basically, this is a systematic review. So we want to really summarize and conclude for the recent studies and clinical trials which are using the liquid biopsy technologies for the cancer patient, in particular, including the geriatric cancer patient. So we evaluate the potential of the liquid biopsy for improving the diagnosis accuracy, clinical decision-making, and also individualized treatment strategy for those old adults. And we also consider the age-related factors, for example, which might affect this biomarker analysis. And importantly, we also kind of highlight the need for patient involvement in the design of the future studies of liquid biopsy. So to make sure that our old adults, their perspectives and also their preference are also incorporated into the clinical research to make it more patient-oriented studies. And so for our result, because it's a review article, so we kind of visualize. So in our review article, we are able to visualize the pipeline, for example, for the future applications about liquid biopsy in the old adults of the cancer care. And in this study, we also highlight the consideration, for example, with the liquid biopsy integrate, for example, with the comprehensive geriatric assessment for the old adults with cancer. And we also summarize our study to show them in 4 different tables, including all the important liquid biopsy-based studies for the patient, young patient, and also old patient, which including the different methodology of liquid biopsy concerning cell-free DNA, CTC, for example, and also other liquid biopsy-based analysis. So the involvement of the old adults was also be highlighted in our result part. And in the table, we also show the key outcomes and, for example, the sensitivity and the specificity of the method concerning about liquid biopsy. So basically, we really want to highlight the importance of liquid biopsy application, because we really believe that it will be a very promising tool for old adults, in particular to minimize the need for invasive tissue biopsies, for example, and also to make the dynamic monitoring for the patient care. And of course, we also highlight the challenging of the age-related mutations, because such as the colon hematopoiesis for the intermediate potential, like called CHIP. So that maybe really affect the interpretation of the circulation tumor DNA analysis. So with this, we really want to say in the future, we want to have more accurate method for the cell-free DNA analysis, for example, and also to be combined other no blood samples, for example, saliva or urine samples, to take these solutions to also to help the patient care as well. And importantly, we also discussed the integration of liquid biopsy into the comprehensive geriatric assessment, which is try to assess not only the medical conditions, but also the functional, psychological, and social aspect of the health of our patient. So we want to use this review article to really draw attention concerning about using the liquid biopsy would be really benefit a lot for our patient, and also to help them to kind of understanding the benefit and also the limitation, of course, of the liquid biopsy, which could also be help to improve the informed decision making for the future. So concerning about additional information, so I would say, of course, nowadays we know that there are really a lot of liquid biopsy studies or trials ongoing, but there are really not so many studies focus or emphasize concerning about application in the geriatric patient with cancer. So therefore, for our study, we really want to make this systematic review, and also to make the statement. We want to, we try to, how to say, to share the scientific community concerning about update of this liquid biopsy research, and also to try to improve the public awareness, in particular our patient cohort, to understanding what was liquid biopsy and what kind of categories and what was the advantage and disadvantage concerning about liquid biopsy, for example, for their care, and try to bring more power and more, how to say, investment concerning about liquid biopsy as a translational research for our cancer care. So with our research article, we always with our systematic review work, we really want to emphasize the importance of patient education concerning about using the liquid biopsy, and also actively involve them in the research plan and the decisions, not only to enhance the success of this technology, but also to empower for them for their cancer care journey.